Really dynamic people who are really passionate about what we do.
Seeing the difference it makes.
IROC champions.
Bringing about intervention, puffers and so forth.
Just amazing to see how responsive the people are.
Looking after the locals.
And improving health outcomes for Aboriginal and Torres Strait Islander people. We have the outreach clinics, we have adult and paediatrics, which we provide to a number of different locations around the state for our Aboriginal and Torres Strait Islander communities.
We set up the clinics, we liaise with communities, we do a bit of media to let everyone know that we're coming.
We do try to promote our health workers and that on the ground to become our IROC champions. So when we go do a clinic, they pick up when we leave.
Part of my involvement with IROC also involves the transport of the equipment, some gas exchange machines that we transport throughout Queensland to all the different clinics. So it's my job to make sure there's an oximeter, a gas transfer machine, a smoke analyzer, and all the stuff that's needed for a clinic to go forth and go ahead.
But mainly supporting our specialists going into the communities and making it easy for the whole clinic to run smoothly. So a big important part is just looking after the locals and the community, and just more or less it's a holistic kind of approach that we take, making the clinic run smoothly.
The difference I've seen is mainly with the paediatrics, with the young ones. We've seen the challenges that they've had with their breathing, with the asthma. Changes that you've seen them from before and after. Yes, it's been huge. And so some of the adults as well. A few of the adults have given up smoking, and yeah, which is fantastic.
Yeah, definitely in the smaller communities you can see a big change. In Cherbourg, we currently see a lot of review patients there because we've managed to see most of the children there. Obviously helping the community in the sense that they haven't got kids coughing all the time. So, and adults are starting to look at the children and try and make healthier lifestyle choices for themselves as well.
The patients come up and say, we're just really grateful that you can get a specialist here, someone that's the specialist in their field, and they appreciate that it's not just one person, it's the whole kind of team, and they're there just for the one person.
We had a young boy had breathing difficulties since he was 2 years old. He came along to one of our clinics after many years of trying to figure out what was wrong. We've brought him here to Brisbane, done some investigations and figured out what was wrong, and we're able to treat this kid accordingly. It turned out that he had a bit of plastic stuck on his lungs that hadn't moved. It just goes to show that plastic isn't biodegradable. It'd been there for 10 years. So yeah, now this kid's providing he sticks to his medication treatment, will live a normal, healthy life as any kid should.
Oh gosh, IROC's made of travel. So we go up to Mornington Island, Thursday Island, Palm Island, out far as Roma, Charleville, Doomadgee, and then we've got the little close ones like Cherbourg, Caloundra, Gympie, Woorabinda, Rocky. So yeah, so we do get to do a lot of travel.
So we actually provide the only Indigenous spirometry training program for health workers in the state, and that's whether they work in a public sector, private sector, Aboriginal medical service.
Bring the spirometry training program to Indigenous healthcare workers, and I think that's a very powerful thing, because if you can get people out there in the communities testing their own people and picking up early cases of asthma and emphysema and bringing about intervention, puffers and so forth before people get too sick, it's less burden on the hospital system as well.
One of the things that we're able to do with our IROC clinics is demonstrate that from first point of contact and assessing parents and families and children's knowledge of their disease and of the way that their disease is best managed, and in subsequent visits we're able to demonstrate that their knowledge is improved and that their management strategies when exacerbations occur is also improved.
We're out doing health promotion in one of our communities that we visit, and a part of our health promotion we do spirometry, and which is a big deep breath in, you blow really hard, and so there's a lot of pushing involved. And one of the ladies that were getting tested turned around and said to me, I don't know if I can push any harder, because if I push any harder I'm going to have to pass wins. Yeah, that was probably one of my favourite stories.
We connect with the community, just make that pathway for us, for the clinics to go into the community, make the pathway clear, talk to elders, radio station, leaders in the community, health workers, and that kind of stuff. Yeah.
So we've been able to go out into the community on days such as NAIDOC Day at Cherbourg and Musgrave Park, and also to schools and do asthma training. These days are really important that with feedback that we're getting, that people know we're out there and those services can be offered to them. So I just think that's really important.
Families, parents and children and extended families are all able to be educated so that they're able to provide good quality care to their children when they're unwell and be able to do that at home.
I've just recently come back from the clinic at Palm Island, and it was just amazing to see how responsive the people are when they know that their clinic's coming to town, and how ready they are to make their appointments and make that contact again regarding their health.
And seeing the difference it makes, it's huge. If IROC didn't exist, it would be a huge challenge.
It's great to be in the IROC team because I know I'll be out there working in communities, helping the IROC team to close the gap on Indigenous health.
I don't think you'll ever get like a rare sort of team like this one because we're very family orientated. So we all stick together, so like if someone's going through something, we'll go through it together.
Another part of our role is resource development. That takes up a lot of our time when we're back in the office. So we develop resources around respiratory illness or respiratory condition.
IROC has provided me with a whole range of new media style outlets, I suppose, so far as resourcing is concerned. We not only just do posters, we get to design them and get them to a point where they then go out to designers to promote for us, to get done. And we get to do that, we get to do things like we do today. On small video clips, we get to do radio jingles.
Our promotional stuff really does get the word across, like with our flyers, and it's not too hard to understand and all that kind of jazz. So we get the word across, and we get heaps of people coming to our stores and getting all the information.
I remember the health promotion day that we did at Koana Waters, and the ground was so sloppy and muddy like you would not believe, and I was thinking, how is this going to work? It was only a few minutes into the day, we all had our shoes off, just slopping around in the mud, and ended in a mud fight at the end of the day. Even the boss, Deb, she was involved with it as well. Everyone got mud on their faces, but it was a great day. I think we did like 86 spirometries that day. So yeah, it was a fantastic day promoting IROC and just meeting other people who are involved in Indigenous health.
At IROC, we use iPads to try and help educate patients. There's a lot of respiratory apps out there developed by other organisations that really help us when we're trying to educate people.
We try to think outside of the normal Queensland Health Square as much as we can, while still working within the square, obviously. So things such as emerging technologies like iPads. For us, there are a lot of cheap and or freely available applications that you can actually use, and it seems certainly from the point of view of trying to get your message across, having an interactive visual display on something like an iPad screen is actually quite beneficial. The clinicians are finding that it's nearly as useful as, second to speaking to your patient obviously, it's nearly as useful as using a flip chart or some other visual media.
Yeah, and just a little quick thing on partnerships. We have, for example, I took lead in doing talking boards, making talking boards up. So that gives us a wider field, I suppose. Plus what we create or what our resource becomes is it's got more standing in the community, I suppose, or more standing because we've actually got people who are professional in their own right in that field. So, you know, with the partnerships, we have lots of partners in with IROC. So it's not only just a part of funding to have as many, you know, all that partnership stuff happening. It's good for us as workers to have good contacts out there who can actually support what we do as IROC.
Considering the amount of time that IROC has actually been around, I think there has been a large body of work that can actually show how hard we do work. And a lot of that is because of the fact that we do have the team spirit between us.
We have a group of really dynamic people who are really passionate about what we do, and so everyone's goal is the same, and that is to improve health outcomes in Indigenous communities, and that's a really worthwhile thing to be involved with.
And I just work with such an awesome team. I have never worked with such an awesome team in my whole working career. And, you know, just knowing what we as a team, you know, can contribute to the communities and improving health outcomes for Aboriginal and Torres Strait Islander people. And there's nothing better. It's fabulous.
I think the sad part for me is seeing how sick our people are, how sick the communities are with asthma and smoking and all the chronic disease and all the different challenges, health challenges that our mob have. And the happy part is going back home to Thursday Island. Besides that, seeing people getting better, being a part of an organisation that is making a difference in the lives of our people in Queensland in relation to respiratory. I would love for IROC to continue to carry on what we're doing way into the future, because the communities and the people in the communities definitely need the service, definitely need the program to help make a difference. Again, I keep saying making a difference. You know, I seriously feel deep down in my heart that that's what we do. We do make a difference as we go into the communities and help with the clinics.